Good afternoon. My name is Lucy Aquino. I'm the Chief Executive Officer of HismanoCare, a program of Advocate Illinois Masonic Medical Center and affiliated with Gottlieb Memorial Hospital in Melrose Park. Thank you for watching CAN TV 21. And today we actually have two wonderful guests that will be talking about cancer and arthritis and a host of other things that are up and coming. But with that, I'd like to welcome Dr. Yajnik of Advocate Illinois Masonic Medical Center. Welcome, and thank you for being on the show today.
Thank you for having me here.
Well, I know that Dr. Yajnik, I know a little bit about you. I know you are a radiation oncologist. You're a physician who uses radiation therapy to treat cancer. And you went to medical school at the University of Chicago, and you did your residency training in radiation oncology at the Memorial Sloan Kettering Cancer Center, New York. Mm-hmm. And you are currently the chief radiation oncologist at Advocate Illinois Masonic Hospital.
That's right.
Welcome.
Thank you.
You know, cancer is such one of those topics that everyone's talking about, but yet a lot of people don't know a lot of. You know about the things that you read. There's all kinds of different types of cancer. Cancer is not just cancer. So with that being said, what is cancer and what are some of the risk factors for developing cancer?
Thank you, and thank you for the great question. We also wanted to point out for our audience that the information we talk about is for informational purposes only and not to replace the advice of their physicians. Cancer is not just one disease, but rather many different illnesses depending on the cell type of the cancer as well as the organ that the cancer originates from. So lung cancer, which begins in the lung, behaves very differently than, say, breast cancer, which begins in the breast, or prostate cancer, which begins in the prostate. And the cell types can be very different. For example, you can even have different cell types within the lung, so that you can have many different types of cancer that arise in the lung. And in terms of risk factors, the risk factors are for some cancers well understood, and for others we're still learning more. But the risk factors are also different depending on the kind of cancer that you're talking about.
You know, there's always a lot of talk about radiation treatment. Can we talk a little bit about what radiation treatment really is, and in your field of radiation oncology, how does radiation work against cancer?
Right. There are three main ways that cancer is treated in the United States. Surgery, where a surgeon goes in and surgically removes the tumor. Systemic therapy, which is often delivered by a medical oncologist, which can consist of medicines given through an IV, such as chemotherapy, targeted therapies, hormone therapies, and then radiation therapy, which is my medical specialty. Radiation oncologists treat more than 50% of the people who are diagnosed with cancer in the United States. And the most common way that radiation therapy is delivered is externally. A machine is used to aim high-energy X-ray beams at the cancer. But there are other forms of radiation, too, that are used for specialized situations. One form of radiation is internal radiation, or brachytherapy, where you might implant a tumor or an area of cancer with radioactive sources. There are even newer forms of radiation that are given through the IV that can target areas of cancer for specific patients.
Wow. Now, I know a lot of people, of course, are afraid of cancer. And what would you say to people who are afraid of a cancer diagnosis?
Well, I guess I would say that cancer is a very difficult problem, and I think it's very natural to be fearful. I think it's very natural to be fearful of illness, potential death, and so I think that those feelings that arise upon a cancer diagnosis, not only in the patient but also in the loved ones, are very natural. And I think we should acknowledge that. At the same time, there are many things that we can do to combat fear. I think one of the things that we can do is to become informed about our illness, so that you can go to great resources such as the American Cancer Society website and learn about cancer, and then ask well-informed questions to your physician, and maybe bring someone with you to the appointment who can take notes for you, so that you have good records on what's been what the tests are.
A lot of times you go to appointments and first of all you walk in there forgetting what it is you want to ask, and you may remember one or two questions of maybe a few that you had, and you walk in there totally forgetting. So it's always really good to bring someone with you.
Yes, I think so. Someone who can sort of be your note taker while you listen and don't have to take notes and things like that. So.
Now, technology has changed leaps and bounds. It changes every day, especially in treatments and health. can we talk about what, I mean, there have been lots of technology changes in the advances of cancer care over the last several years.
Yeah.
What are some of those?
There have been some incredible changes in the treatment of cancer and in the early detection of cancer over the last several decades. If you think back to a couple of generations ago, I think cancer was a very different illness. I think back then, I think the majority of people who were diagnosed with cancer, expected to pass away. This is two generations
it was a death
ago.
Sentence,
yeah,
really.
yeah,
It was a death sentence, right.
it was something that was feared, and so people were often afraid to even say the C word, even to their family members and loved ones. And women might present back then with large tumors in their breasts that had not been caught early, and were much more difficult to treat. And cancer now is a very different illness, and I think that a lot of the success in cancer comes from our ability to screen for and detect early some of the main cancers in our society. And so I think that early detection and prevention efforts have really helped a lot in terms of cancer.
And that's very important. And now that you brought that up, I know some people, you can get some more information about cancer screenings. For example, I know that you have coming up.
Yes.
Let me share this. You want to talk a little bit about that?
Yeah, we through the Advocate Illinois Masonic Medical Center, through the Criticos Cancer Center there, we have several screening programs that are coming up. There's a melanoma screening. Melanoma is a form of skin cancer. That's on June the 17th. We also have a prostate cancer screening on June the 27th. And we have a breast cancer screening in October.
Right.
And you can get more information by calling 773-296-7089. That's the main line to the Criticos Cancer Center to get more information about the screening programs.
And they can also call the 1-800-3-ADVOCATE number or 1-800-323-8622 for registration for any of these screenings that are actually being sponsored by Hispano Care at Advocate Illinois Masonic Hospital and the Cancer Center, the Criticos Cancer Center of Advocate Illinois Masonic Hospital. And all these screenings are absolutely free to you. So please call 1-800-3-ADVOCATE or 1-800-323-8622 to register for any of the screenings that were just mentioned, with the breast program screenings on clinical breast exams in October, our prostate screenings that are coming up June 27th, and of course our skin screenings that are coming up on the 17th. Real important. And I know that you will be part of the talk at the prostate screening.
I'll be giving a talk on prostate cancer at that screening.
Now, in addition to some of the things that we're doing here with Advocate, Illinois Masonic, and some of the free community screenings that are being done, where else can people get information on cancer?
Well, I think that if you want to get information about screening, I think that two best ways to get information, probably the best way, is to speak with your physician during your annual checkup. And your physician can give you specific advice about screening that's tailored to your particular needs, because screening is different in different people depending on risk factors and things like that. And as I mentioned earlier, the American Cancer Society really has a wonderful website at cancer.org, www.cancer.org, and they do have some screening guidelines available on that website also.
Great. What would you say to someone who is scared to get screened, Doctor?
Well, it's an understandable emotion, fear, I think, but at the same time, I think that it's detrimental. I think screening saves lives, and it's very important to get screened, because if you catch a problem early, there are many cancers when caught early that are very curable.
Let's talk a little bit about, we have the breast program coming up in October, and we're doing clinical exams for these women who are coming in addition to the lecture, obviously, to learn more about the prevention of breast cancer. And with the exam itself, it is clinical, and we're going to have resources and referrals for women who can't afford mammograms, where they can go get free mammograms. But if you have a couple of minutes to get our audience to adhere, to come out, get screened, get tested, if it's a family history, what would you say to them?
I think it's extremely important to take steps to reduce your chances of cancer, which I hope we have a chance to talk about a little bit today, because there are many steps that people can take to reduce their risk of developing cancer in the first place. And then screening. We're one of the only countries on earth that offers screening programs that generally tend to be covered by third-party payers, and generally it's convenient. You can go to your primary care doctor and you can get the referrals for all the tests that you need to get screened for cancer.
So, it's even without insurance here, because it's so accessible to us, yet we still don't do it.
Right. And I think that fear may be one of those things that prevents some people from wanting to know. But I think it's important to get screened to catch any potential problems early.
All right. Well, Dr. Yajnik, again, I want to go to just reminding individuals, for those who are listening, our phone lines are open, and you can give us a call. The number is at the bottom of the screen, and lines are open. If you have any questions for Dr. Yajnik or for Dr. Tambar, who's going to be joining us in a few minutes, please, they're both here. You can take your call, answer your questions. Again, I want to remind you that if you want to register for any of the upcoming events, please call Hispano Care at 773-296-7157, or you can also call the Advocate number at 1-800-3-ADVOCATE or 1-800-323-8622, and that phone number is completely free. Again, Doctor, we got 1 minute. What's the last thing you want to say to our viewers?
There are many things that viewers can do to actually reduce their risk of developing cancer. I think that, for example, there are some risk factors that would be very surprising to some viewers. For example, obesity is a risk factor for certain forms of cancer. For example, there's a form of uterine cancer called endometrioid cancer, where the risk of that cancer is increased as a result of obesity, because obesity changes the hormonal milieu in your body. Smoking prevention is extremely effective at reducing your risk of cancer. You should not smoke cigarettes, because that can cause not only lung cancer but other forms of cancer also. And a diet that is full of naturally found things such as fruits and vegetables, and that limits animal fats, I think, is also beneficial in terms of reducing your risk of cancer.
And the last thing, I know that we talked about this a little bit earlier, and you had said to me that by the year 2010,
well, by the year 2010, cancer is going to become the #1 killer. It's going to overtake cardiovascular disease, and I think that we can all take steps to reduce not only mortality but also even diagnoses of cancers by doing things like not smoking cigarettes, and by making sure that we live a healthy lifestyle, eating fruits and vegetables, limiting the amount of meat that you eat, and getting plenty of exercise.
Prevent. Dr. Yajnik, thank you so much for joining us on the show today. Again, I want to remind our viewers that to join us for the melanoma skin cancer screenings that are going to be done at the Criticals Cancer Center at Advocate Illinois Masonic Hospital on Wednesday, June 17th from 5:30 to 7:30. The cost is free, so to schedule an appointment, please call 1-800-3-ADVOCATE or 1-800-323-8622.